It is a service of Sylvia Global Media Network, and today we're so fortunate to have Dr. Jean Dodds joining us today. So, hello, Dr. Dodds, and thank you for your time. I really appreciate it.
Hello, Carolyn. Good morning, everybody.
Uh, this is going to be so interesting because I personally have been using Dr. Dodds products in my practice and been seeing not only this product we're talking about today, but we'll have a couple more of these together, and seeing unbelievable results. Things that I was never taught in veterinary school, never taught in traditional Chinese training, never taught anywhere. And I can't even remember how the hell I ran across this, but God bless you. So today our topic is NutriScan. So Dr. Dodds, would you mind telling us a little bit about what NutriScan is and why it exists for us now?
Well, NutriScan is the only patented salivary diagnostic test for food sensitivity and intolerance in animals. And we do it in dogs and cats, and we're about to launch the clinical trial for horses. And we're very excited about that because their foods are different. We need legumes, we need forage grasses from different parts of the country and different countries. And so getting the highly purified, affinity purified food extracts for horses was a chore, and it took about 6 months, and then we had to find the right antibodies, but we're ready.
Oh, isn't that exciting? That's very exciting, especially crossing the bridge between our dog and cat, or that kind of conventional mammal type in your hospital practice to the equine community, because they're quite different, and many people aren't aware of that. So can you let our viewing audience know why the heck horses, well, digestively speaking, are so different?
I think we're worried about mostly performance horses, but also companion horses that people ride in trails and whatever, because they can have asthmatic type conditions. They can have a lot of inflammatory bowel disease conditions that are just something not right about their feces or whatever, or their appetite goes off periodically. But horses are difficult because the animal has to not have eaten anything for 3 hours or longer before we do the test.
Right.
So could horses squirrel away some forage grasses in the back of their mouth or whatever? So we've got to rinse out their mouths, and if they're not in a stall where we can't have them munch on anything, we have to cross-tie them for 3 years so they don't eat anything. Otherwise, you'd be measuring that instead of, what's going on in their gut.
Wow.
So it's fun.
It is fun. So we're going to cross-tie them for 3 hours, not 3 years, because that might end up making some people uncomfortable.
Well, we'll see. I mean, we don't know. We're just doing the trials to see if it's feasible. And obviously, a lot of these horses are worth a lot of money. And the commitment, of course, of the pet guardian for their horse. So we have to make sure we can do it properly. That's the purpose of the clinical trials in both healthy and horses we suspect or we know have some kind of leaky gut.
Oh, you know what? That's so wonderful. I mean, it's so wonderful because these wonderful horses, when they're ill or they have regurg or they have some GI issues or asthma, like you mentioned, it's a deal breaker in some cases, isn't it, with these performance horses and our companions with their ability to go out and be a horse. So isn't that true?
Yeah, let them think about a high-performance horse in Texas that goes to compete, in a very high competition event in Ohio, and what they're breathing in is totally different, and all of a sudden they're foundered, or God forbid, or they're lethargic, and they don't have their sparkle, and they're not going to win.
Yeah.
Not that winning is the most important thing, but it's part of the relationship between the rider and the horse.
Yeah. Yes. Definitely. Now, with back to our NutriScan for our doggies and our kitties. Now, can you tell us how NutriScan is different from many of the products that traditional and other veterinarians offer to their clients? We know about interdermal skin testing. We know about blood testing, and that those are, the results, they're just like everything else. Sometimes yes, sometimes no. How is NutriScan different, and what is it monitoring? What is it telling us about the creature?
Those are very important questions, and we can step back a bit and think about, why did I develop it in the first place? Because we have so many animals that have chronic medical problems with leaky gut, and we were dealing with our Diana Laverdure and I with our new book, Canine Nutrigenomics, and trying to figure out not what recipes animals should have, but that each animal or person is an individual, and they have to eat what's best for their genomic expression. how their genes express themselves in a positive way. So I started to look at that. Well, how can we test for food sensitivities and intolerance in a better way than we currently do? And if you go and look at the literature, even for human medicine, where they do testing on serum for food reactivities, they call them food allergies, but they're not really allergies, they're intolerance. It doesn't work either. It's not predictive. So they do the tests, and it's been going on for decades, and it's not predictive clinically when they follow what the results are. So I thought, oh dear, this isn't going to work.
Right.
And we can't do patch testing on dogs and cats very easily. You know, shave the whole side of the animal, and the poor animal's embarrassed, and it's cold, and it's got to wear a coat, and we look at all these reactions, and we see whatever. Do we do food elimination trials? Well, you know, veterinarians try that, and they put animals on expensive prescription diets or other grain-free, novel, antigen-source foods, and they tell the client that the pet has to eat it for 6 weeks. Well, after 2 weeks, nothing happens, and they're fed up, and the animal may not like it. It costs a fortune, and the children in the household are feeding the pet, you know, treats under the table because they don't want to eat what they're given either sometimes. So we just don't have good compliance, and people get frustrated. So I thought, well, let me look at this, and I started to find on the human literature about 5 years ago a lot of work about salivary diagnostics, generally, and in the dog I found it from the Orient. How do they determine which dogs should be trained for seeing eye or other special functions within puppies, for example? And let's take, say, Labrador or German Shepherd puppies that might be used as guide dogs. How do they do that? Or, you know, it could be other breeds. And if they could just look at the puppies when they're younger and determine which ones are more trainable or tractable, then they would select those. And they did salivary cortisol levels between litter mates to decide, gosh, which ones would be less stress reactive. Right. And I thought, oh my God, saliva. And then we have all this stuff about human salivary diagnostics. You know, for infants, for example, it's much easier for the physician to get a sample of saliva than it is to, you know, pin prick or, oh my gosh, the poor infant. And so I thought, this is it. We're going to need to do saliva. Well, then I met a very interesting immunologist named Dr. Ari Vazjani, who was in Arizona at the time, and he's since moved. And he started looking at human food-related salivary diagnostic testing. Not exactly the same way we do it, but he did something very interesting. In about 2009, he published a paper comparing fresh foods of all kinds, fruits, vegetables, meats, fish, etc., at a grocery store. And then he took the same raw foods, divided it in half, and cooked some of them. And he found that the raw foods had 4 to 5 times less protein unfolding antigens to be exposed to the body than the same food that was cooked. I thought, all this is getting very interesting and makes perfect sense.
Wow.
Because what does the body see when it eats something?
Antigens.
It sees the mucosa of the mouth, right? The upper GI tract, the bowel, the rest of the bowel, and of course the rectum. And so we now know that you can look at saliva or feces to determine what the surface of the bowel is reacting to. When it reacts, it produces antibodies, and they're going to be secretory antibodies, those that are in secretions, like IgA. And then your primary immune response, if you first eat a food that you haven't seen in the last 6 months or so, to see if the body likes it or doesn't like it. And if you're gluten intolerant, like I am, oh my God, you know, I eat gluten, and I'm in big trouble. So we're starting now, the gluten thing is not just a fad. It's very real for those of us as we get older that don't tolerate gluten as well. And I haven't for 3 or 4 years. It's made a huge difference to my energy, my brain health, reducing senility at my age, whatever. And also it makes you, even though you may weigh almost the same, your body loses its middle tire and the bloated feeling you get when you eat glutens. And so it's huge. This is just
so you said that there is an immune response, an Ig response in our body that you can measure both salivary and fecal, and then there's another immune response to foods that are, or something that's introduced to you recently, and that your NutriScan measures both of those. Is that correct? Is that a correct understanding?
Yes, the NutriScan looks at secretory immunity through IgA that the animal has seen over the last 2 years or so, and then the primary immune response, which is going to be up to about 6 months. And then you see if it's a long-term immune response, it becomes IgG, and that's your long-term immune memory cells.
Uh-huh.
So, but the problem is in humans, for example, in Europe they do salivary testing. In North America, there's only one company that does it in saliva, and I was so excited about it. Turns out they only do 4 foods, and they're glutinous. So what the heck good is that?
No.
But there is a lab called Lab that does fecal testing in humans, and I've not tried them. We decided not to do feces for dogs, cats, and horses. We thought that was not good. Hundreds of samples coming into feces every day. My lab staff would not be happy, so we went to saliva instead.
Well, it sounds very reasonable of you. Very reasonable of you. Now,
I'm sorry, I wanted to just clarify. This is not antibodies to IgE and IgD, which are what we do looking for allergies. And true food allergies are really rare in veterinary medicine, and they're quite rare in people. You know, the child, God forbid, that eats a strawberry or a peanut and keels over. We don't want that. We absolutely don't. And we know there's a huge issue about that on places of public transport to make sure that food given says it's not made in a factory where peanuts are also produced or whatever. So this is different. And so most veterinarians and pet guardians are used to doing serum testing, and there are still some very reputable companies that do serum food allergy testing, which is really not what we should be looking at. So I have nothing wrong with these companies doing environmental allergies, you know, like inhalant allergy testing, but the food allergy testing is not going to be clinically predictive, as I've explained.
So the sensitivity and intolerance to food proteins or food antigens that stimulate our bodies and our lovely non-human friends, this is not the same response you get if you have a true allergy. Now, when I talk about allergies, I talk about things that cause you to be immediately swollen. You need to go see a doctor. You need an EpiPen. You need something going on. An allergy is when the body immediately, not necessarily malfunctions per se, but I mean, not necessarily attacks itself, but I mean, you need immediate help if you have an allergy. I think seafood, I think peanuts, I think sometimes corn allergies, and I'm thinking more on the human side. I'm thinking vaccine reactions, those types, and I think that people don't use the correct words, if I can be so bold, and I think it's important when we use language appropriately when we're talking about intolerance. Like, I'm intolerant to a lot of things in my life. It doesn't mean that I'm reactive to all of them. I'm just kind of intolerant. So can we kind of clarify that language, because I think that even, you know, veterinarians, you know, my tribe, we use the words sometimes, and our clients just reuse them and reuse them and reuse them. So can we just really get some clarity on that, please?
It's very important. We use the term allergy loosely all the time. What we're really meaning is a reactivity. What you're talking about, an acute facial swelling, rubbing the eyes, scratching on the furniture, biting at yourself, that's an anaphylactic or anaphylactoid, anaphylactic-like reaction, and it needs antihistamine and sometimes epinephrine and immediate things. But animals can have both. For example, we have a long-term client that comes with a gorgeous little cattle dog mix, and she had horrible bright red rings around her eyes and her nose and chewing her feet. She has a little bit of demodectic mange around the eyes because her immune system was suppressed, but she did a NutriScan test because all the other tests didn't help her. And within 3 weeks of changing the food, the redness had gone down 75%. We just saw her again yesterday, and it's almost completely gone. However, if she eats chicken, let's say someone in the household throws a piece of chicken to her, she gets an immediate swelling and hypersensitivity reaction. So she has, sorry about the phone, she has hypersensitivity and intolerance, both.
Okay. Yeah.
The phone is not in the room, so I have no idea where it's ringing.
That's fine, but the thing is that there's no reason that we can't have mixed responses in our body. We do it every day, right? And that the fact that our clients understand that because you're a reactive creature, because you've got those components, doesn't mean we can't do good work on a different front, like you said, with doing the NutriScan testing, or understand that I'm a little intolerant here and I'm a little bit itchy there, but if we discover things on this aspect, we can help with maybe 50, 60, 70, or 80, and then don't give the dog chicken. I mean, I know that's simplistic of me, but it's a beautiful thing that we can actually help, and sometimes people get desperate and these animals suffer, as you know.
Right, and chicken and venison, for example, are two of the classical pro-inflammatory hot foods in Chinese medicine. So you're revving up an inflammatory system. But remember, you give antihistamine when you have this acute anaphylactic-like reaction, and then you give the right food and whatever. Also, don't forget that the animal could have an environmental inhalant allergy as well as a food intolerance. So we have to do both. And this particular animal I was talking about from yesterday also has environmental allergies, and she wears booties when she's on grass and weeds, Therapaws specifically, to prevent her feet from touching those reactive inhalant surfaces. So you can have both. It's very important to test for both, actually, when you're doing. And the classical sign, even if you don't have, because, well, my dog never has diarrhea, may have a little constipation, sometimes, every month or so the dog doesn't want to eat for a day or two, but what I really see is itching, 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 itching. Well,
yes,
that could be a food intolerance, absolutely.
Absolutely. And now, what about our gurgly guts? What about our belchy, farty dogs and cats? And what about these guys that kind of feel dumpy? Because I got to be honest with you, if I eat something that makes me bloated or I'm gassy, I'm not at my best, to be honest. Well, obviously, but our non-human friends, our pets, we're going through the same thing, and a lot of times we just don't recognize it as possibly being what we're talking about today. Even if they're not tearing their skin off or itching like crazy, that kind of gurgly gut stuff, the belchy farties, that's not comfortable either. So you can figure that's the first organ that these foods are going into. So being a reactor, or not a reactor, but intolerant, of course.
I have a Belgian Tervuren, actually, that is a working police dog and also does herding and stuff. Nice. And she goes berserk whenever she comes into estrus because the client has decided not to spay her. I think he will eventually, and she's very reactive to weeds and grasses as well. We've taken care of the food. We got her through her estrus, so things were better. And what he says was, well, in order to get to the training field, I have to go over grass and weeds. I said, duh. You're going to have to put booties on her or carry her. She's not that heavy. Carry her over to there. Oh, he says, that's a nuisance. I said, hey, let's not go there. You either do it or you don't do it.
Don't, yeah. A nuisance, right? So you have a high-performance dog who's actually doing its job, doing what it was meant to do, and happens to have some glitches, and then we consider it a nuisance. So that I would have absolutely nothing fun to say about that. So you're so tactful. I love that, Dr. Dodds. Now, your NutriScan test, it tests for 24 different foods. Is that correct? The response to 20
antibodies, right?
Yeah. So that's fairly vast. Yes. I mean that covers quite a bit, because it's not just protein, is it? I mean it has some of it's got our lentils, and it's got some potato, and it's got a barley and millet. So it's not just don't feed your dog this protein, this protein, this protein. And I really thank you for mentioning the traditional Chinese thermography of food, hot, cold, those sorts of things. But tell me about the scope to which you're testing and how that's helpful for your people that are using it, because I love it.
Well, part of the problem is that everybody says, well, when are you going to test fruit? When are you going to test this? You can't. It's just totally, it's not feasible. It's too expensive. These are highly affinity purified peptides that we get from Germany. It's the only place that makes anything clean enough, and every lyophilized vial that we bring in, they're very expensive, by the way, but we dilute them way down. They're affinity purified, and we get the affinity column with them to be sure they're 99.9% clean. In other words, we're not measuring contaminants. And there weren't any other food extracts, with all due respect to the companies that make them in North America, that had this degree of cleanliness. Remember now, when we test lentils, that's also peas. So many commercial pet foods have peas in them now. That's a phytoestrogen. So like soy, we have to be careful about soy and peas for animals that are intact, going to be used for breeding, because of the potential issue with fertility or delaying puberty or whatever. The only other thing we're concerned about is there's a lot of millet, which is an excellent ancient grain being put in pet foods today.
Yes.
Millet is a goitrogen. A goitrogen is a food which promotes thyroid disruption, the disruption of thyroid function, like our cruciferous vegetables, cauliflower, broccoli, et cetera, et cetera. So when you cook cruciferous vegetables, these are for animals with thyroid dysfunction or at high risk because of their breed history. You cook them, it does reduce the goitrogen content if you cook them, mush them, but at least cook them. However, if you cook millet, which of course you'd have to eat cooked, it raises the goitrogen content. So we have to be very careful not to feed millet to animals that have thyroid dysfunction, that have a family history of thyroid dysfunction, or a breed at high risk for thyroid dysfunction. We're learning so much about this all the time now.
That's crazy. I mean, it's crazy because the thing is that in this one question I just asked you, I just learned 5 new things, and in my head, all I keep thinking about is all my clients that I've done this test on and actually are hypothyroid. I'm like, uh-oh, I need to call them. I need to make sure they're not, because we discovered all these wonderful things that they can eat and things that they can't eat, and I'm like, oh boy, I need to call them and see what the heck they're feeding, because it's like liberating to know what you can feed a dog that's real food. If you're cooking with real food, or looking at a product that's high, high quality real food. And the ancient grains you mentioned, which is just lovely. I love those. But now you got me thinking. You got me thinking.
Well, and remember that we avoid glutens. We want to have a variety of whole foods that are dense in nutrient value. And just avoid those depending upon a particular health situation. For example, for older dogs, to protect brain health, I mean, you're going to use great things. You use kale. You're going to use turmeric. You're going to use pomegranates and berries, blueberries, healthy things to protect the health of the brain for now and also in aging.
What about coconut in these guys? I mean, I know it's not on our list, and it's something that people don't, and it's a completely different coconut controversy. I understand that, but with the brain health, I'm a big fan of the coconut oil, right? I mean, it's just, it does amazing.
Krill oil, krill oil being the ancient Christian. Oh, I learned about a fantastic ancient oil that we've all forgotten about, moringa oil, M-O-R-I-N-G-A. Moringa oil is an ancient oil, Asian oil, that has all kinds of high nutrient and high omega fatty acid contents, and it's a great oil. So I just learned about it teaching a webinar from somebody who asked the question, what about moringa oil? And I realized that we didn't even put it in our book about, borage oil and coconut oil and olive oil and krill oil and primrose oil and oil and oil and oil.
And we missed it.
Yeah, and hemp oil, which is good, but it's got too much omega-6 and omega-9 for the dog. It doesn't have as much omega-3. So if you're going to do omega-3, if you can't have fish oil because the animal's intolerant of fish, then we would look at these other plant oils. We should think about moringa oil. It's amazing. So now it's my new thing to try.
You just gave me more homework to do today. Now you brought up fish. Now, in the panel that you do in NutriScan, one of the classifications is white fish. Now, what is the definition of a white fish? What's involved in a white fish? Because I have to be honest with you, I'm like, is it every fish that looks white? Is it not salmon? What the heck is a white fish? So if my dog's positive for white fish, what do we not feed them?
Okay. Well, first of all, it's a white-colored fish. It's basically ocean and lake whitefish. Okay. That does not necessarily include sardines. They're usually okay. It would include herring. It wouldn't include anchovies, of course. Salmon is totally different. Salmon is an oily fish. It's a red fish. So white-colored fish. And remember that many, many commercial foods have Manhattan fish meal in them. That's a white fish. It's a no-no. Also, another thing, Carolyn, trout, mackerel, skipjack, and bonito. Remember the bonito flakes in Oriental seasonings? Those are high in what we call vasoactive amines. That means they stimulate the surface of blood vessels. So again, they could promote inflammation like chicken and venison. So we don't want to feed them.
Yeah, yeah, okay. All right, so I got that. That's awesome. That's wonderful because if people ask me this, I'm like, well, they all look kind of white to me. I don't know. I'll have to ask the pros. I don't know. Now, seriously, the next question I have is that is there an age which is too young to get valid results for a NutriScan based on the way the immune system thrives and grows and morphs and such? Is there,
It,
like I said, is there an age at which is too young
well,
for a valid test?
right. We usually start at puberty. Some people want to have a baseline at puberty when their animals have gone through, even if they're neutered or spayed, maturation as a body type, and have a baseline to see what's going on, and then do it periodically after that. So that would be puberty. However, we had an orphan German Shepherd puppy at 10 weeks that was fed concentrated cow's milk because they wanted to beef up this malnourished puppy right away. It was an orphan rescue.
Okay.
Highly reactive to cow's milk right away, and that was done at like 16 weeks, I think. So if the animal has signs that are classical, excuse me, for a food intolerance, and it's younger than puberty, you can still test
Okay. All right. That's great because I've been really excited about this product in my practice, and everywhere I teach, everywhere I talk to, every social media, I'm like, okay, this is the greatest thing ever, and it works. I mean, I got to tell you the truth that I sent a dog a NutriScan to NutriScan that had been blowout bloody diarrhea, losing weight, had been put on steroids, immune suppressants, and was up for, oh, and then, one of those really, really hydrolyzed foods. And then,
cardboard.
exactly, it's not, I can't even call it food. That's my problem because it's not actually food at all. And they came here before going to get a colonoscopy, and I'm like, oh, please, 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 please don't do that to this little doggy. And we ran this test, and this test came back amazingly limiting in what this dog could actually consume. And so, yay, right? Yay. And the dog also had some other stuff going on, but I swear to you, Dr. Dodds, in 4 days on food that was okay, this dog, all clinical signs stopped, her brightness of her eyes, correct posture, happy to be around, and started gaining weight in like less than 7 to 10 days. And they're like, oh, it's a miracle. I'm like, I agree with you. Holy smokes, So although some animals aren't as drastic as that example, I know for sure that this test, because they've been tested for everything else, and the dog was, I lie not, dying. I mean, she literally was just not able to stay functional. She was so deficient. So that's a very, thank you so much. But the importance of this test as an option for minor, major, serious protocols, I find it invaluable. So I want to thank you for that. Now,
We
if
have
you,
hundreds of those stories in the 7,000 tests we've done, and we've done some that work 80% and not, as much as this one you've talked about. Sometimes it takes only 48 hours, sometimes it takes a couple of weeks. Some of these animals have other issues. They've got fleas, they've got inhalants, they've got other things, they have reactions to dust mites, whatever. So we have to deal with a total package. It's really, really important for people to understand that we offer this test. The reason it's costly is because there's 24 highly purified food antigens. It's not commercially available. We have to have the plates manufactured for us. It's done in duplicate and with 2 antibodies. So that's 4 assays for each food times 24 foods. Now, there is a test that's been advertised, which I'm not going to say much about other than it's 250 antigens with a cheek swab or a blood spot for $49.
oh,
There's no science behind that. It's never been published. There's no veterinarians involved, and the public just needs to be aware. You get what you pay for. You can't do it. It's impossible. The other thing is we do offer rescue discounts. We offer discounting for special needs animals, animals that are service animals, whatever. We do offer discounts for hardship cases. If anybody is concerned that they did something wrong, we don't automatically say we'll do the next one for nothing, but we have done that on a variety of occasions. We're nonprofit, so we don't make any money, but we're here to help the pet.
Dr. Dodds, say what you just said about this all kind of alternative testing that's being offered out there. Where is it that people are running across this thing? On the internet? Dr. Google and
Internet.
Dr.
Yes,
Wikipedia?
that's on
Or
the internet, and I don't want to name the name,
no, I'm not asking you to. No.
but people are asking me, I'm going to do this test for $49. Why should I pay you whatever, 250 or 280, depending on if it's a veterinary sample or a pet owner sample or whatever? And we say, hey, just ask them, where's the published science for it? How can you do 250 antigens, not foods, everything, for that price? How can you do it on a tiny sample, like a dot of blood on a filter paper or a cheek swab? And where are the veterinarians that are interpreting this?
Right.
So
right.
we just have to, hopefully these things will make their money and get out of the marketplace. People are just gullible.
I couldn't encourage people more to ask questions, just like you're saying. Where's the science? Where are the doctors? Where are the results? How can you possibly do this? Now, the one thing I find is that people don't even know what an antigen is. Can you just briefly describe that? The antibody-antigen relationship. I know that's like a 2-year course. I understand that, but a quickie, so that if people ask educated questions, they could try, right?
Yeah, antigen is just a protein, and anything you react to has an antigen. It can have other things in it as well, but any protein fraction that your body sees, your body can either accept it and not cause a reaction, or reject it and cause a reaction, and that reaction is an antibody. It's a specific part of the immune system that's directed against that antigen, saying, hey, barley, you're a gluten, I don't want you, I'm going to make anti-barley antibodies, and it's going to show up in the saliva.
I love that. Now, Dr. Dodds, the quality of medicine and the quality of testing that you offer to the veterinary community, and correct me if I'm wrong, it's worldwide. You have this wonderful neighborhood of the entire planet. Your company, your business, you offer other services for veterinarians, for pet parents through your organization, yes? Would you just briefly tell us what other services that you provide, and that one of the beautiful things I love about you and your organization is that clients can send you samples that are appropriately acquired directly to you, and then as long as you have a veterinarian in the circle that's going to get the results, it's fine, but you don't necessarily need to go through the standard protocol of in the office, have the doctor send it, those types of things. It's very much an independent, empowering process that you allow pet parents to have. So if you wouldn't mind taking a minute or so and telling us what services other than NutriScan that you provide, and how the folks that are watching this can get involved in a very positive way.
Correct. The only test that we provide to pet parents directly is NutriScan. But remember, once they get the results, they're going to have to seek professional help from their veterinarian, hopefully, to pick the right food, because they're not going to necessarily know what to do. Now, there's some very experienced pet breeders and guardians that know a lot about food, so they can switch from one to another. That's not the issue. All the other tests we offer at hemopet.org through our diagnostic division, which is Hemo Life, are done directly through veterinarians, or veterinarians must be involved. Yes. It's required, not only because you need a patient-client professional relationship, even for vaccine titers. And there's a huge issue right now about a large pharmaceutical company offering shot protocols through mobile veterinary clinics at their drugstores throughout the country, and it's being challenged now by the AVMA as appropriate, because obviously these shot clinics for rabies, etc., in packages haven't got an established patient-client relationship with that animal. The history, what's going on, etc., just the physical presentation at the time. But we just found out yesterday from a veterinarian in another state that there's a professional dog trainer that's having her clients put their veterinarian's name on the submission form, and we get it with the veterinary clinic's name, to do titers. And we give the results back. not knowing that the vet, I mean, somebody drew the blood, obviously.
Yeah,
I
yeah,
mean, we didn't, and we don't know. And the veterinarian said, well, we need to do something about it. I said, you know, we can only go on what we get. We can't
yeah.
prove that veterinarian named in the client box is the veterinarian that drew the sample. Maybe they're a vet tech who does it in their spare time. We don't know. But this shouldn't be about those things. Part of the problem is in the veterinary profession, some of the public believes that we mark up test costs so much that they can do it less expensively. Now, hemopet.org is a nonprofit company, so on our website, those prices are available to anybody, just as they are in any university diagnostic lab. Because as nonprofits, our products are available. But that doesn't mean that the client's going to not pay the veterinarian for their time, for drawing the blood, for their hazardous waste control. You know, they have to throw away the syringe and the needle in a special sharps container, for their interpretation, for their follow-up, for their looking at the client history and the patient physical exam to decide, is this test result going to help us keep the patient healthier, vis-a-vis, say, a vaccine. So it's hemopet.org. HemoLife is the division, and we offer many tests. We are the only lab that does non-radioisotopic patented complete thyroid profiling based on a breed and age-specific interpretive comment. We're the only place in the world that does that, based on 20 or more years of my cumulative database. So it's non-radioisotopic, so we're not harming the earth. It's patented worldwide. My husband's a patent attorney, as our NutriScan patents are worldwide, by the way. And we do that testing. We do vaccine titers in-house. We do heartworm antigens in-house. We do all our NutriScan and thyroid testing in-house. The other testing we offer, anything anybody wants, we can offer, and we can give people, when they contact us, the price for a particular specialty test, which we send directly to that specialty lab. Be it a gastrointestinal digestive profile to Texas A&M, for example, be it some kind of toxicology testing, whatever. So we send things direct, or all our rabies titer testing, like those in the country, go to Kansas State. Rabies diagnostic lab, and we're working closely with Dr. Michael Moore and his colleagues there, because they just published a fantastic paper in the Journal of the American Veterinary Medical Association in mid-January, showing that animals close to the end of their rabies expiration date or beyond it, when they're given a booster, get even higher titers than those that are in date. And that has changed the entire rabies surveillance program for the Compendium of Rabies Control Officers. And there's currently a survey of veterinarians, holistic veterinarians, on the American Holistic Veterinary Medical Association website. So far, 160 some veterinarians have taken it to see, would we offer titers if they were available at discounted prices from Kansas State University for those animals that we feel should not be vaccinated, to try to change the state rabies laws. And so our second website is www.rabieschallengefund.org. That's the challenge study being completed by Dr. Ronald Schultz at the University of Wisconsin and ourselves. We're in year 6. We're currently in the challenge phase of those trials, showing clearly, as Dr. Moore and his colleagues have, that antibodies to rabies virus last much longer than the 3 years they're currently allowed for vis-a-vis the federal regulations.
Yes. Isn't that just, it's inspiring, wonderful work, isn't it? I mean, it's just a wonderful thing to see that, you know, stepping outside the norm, or stepping out what we're told or is acceptable and has to be done. And now I grew up in a medical family, so that whole the white coat syndrome, I got it from both ends. You know, like and Dad, whatever he says, but then also becoming one and being on the other side of the table. It's a joyous feeling to think outside the box, and now have the opportunity to test outside the box and have options everywhere, and have these wonderful veterinarians that are doing the hard work, such as yourself. So I've got nothing but the utmost I just love what you do. It's just so helpful for me. It's crazy.
One more thing, Carolyn, we changed our Hemopet email address from hemopet@hotmail.com recently to info@hemopet.org.
Okay, all right, good.
So we're now part of the Microsoft, whatever it is, 365 system, which is fancy and has so many bells and whistles on it. But it's info@hemopat.org, and it will transfer from the old email address, but eventually that will disappear.
All right, that's good news. Now, no, beautiful. Now, I want to kind of show the world. Now, I guess the last pseudo frustration I have is that so few people know about NutriScan. Maybe just in the community in general, but in my experience in the veterinary community, it's not something that I'm getting frustration from my clients saying, I was told that this kind of testing doesn't exist. I was told, like, I ask about this, or they just didn't know. They were never told, those types of things. So I'm going to take a second here. Now, this, everyone, is NutriScan, okay? You can get it. We can folks, non-veterinarians, get this from you, correct?
Yes, correct.
Beautiful. Then it comes in a package like this. Ready? It's very, very difficult, everyone. You rip it open, and there's a rope inside. The rope goes into your pet's mouth, and it soaks up saliva for a certain amount of time. It's supposed to be
after fast for 3 hours.
Yes. Okay. So no food for 3 hours, and then 2 minutes of this in your pet's mouth. And then when they do the cat one, the only difference is the rope is thinner, so I guess it doesn't irritate the cat so much. Then you stick it in this lovely little tube here, and you mail it off to Dr. Dodds and all of her wonderful staff that do this for you, okay? That's it. And then they send you this type of report. It has got so much wonderful information on it. So this thing is not rocket science. Everyone can do it from their living room as long as their pets haven't eaten in the last 3 hours. And the amount of information you get is priceless. It's priceless. So Dr. Dodds, you're the best. I mean, seriously the best. So thank you very much for your time and your amazing intellect and your drive, your spirit, your energy is just, you constantly stimulate me and make me want to be a veterinarian. So, like I said, I appreciate everything about you, and we will be lucky enough to have Dr. Dodds on again talking about nutrigenomics and her new book. So, thank you very much, Dr. Dodds, and I will be talking to you soon, yes?
Thank you, Carolyn. Many hugs.
Mary Hennigs to you. And thank you for watching Sylvia Global Media Network and Holistic Pet Care with Dr. O. And we will have many, many more wonderful guests to talk about ways to improve your relationship with your fuzzy buddies. Goodbye, Dr. Dodds.
Bye. Thank you.